Plotting points on a growth chart. A case study of Sam. Let's look at how to plot points on a growth chart with an example. We just received a new infant in our care named Sam. Sam is a 10-week-old male, and we want to look at his linear growth. What growth chart should we use? We want to use a WHO growth chart specifically for boys. Since we want to measure linear growth, and Sam is an infant under 2 years old, we should use a length for age growth chart. Did you choose the right one? At the first clinical visit, we measure Sam and find his length to be 54.8 centimeters. Let's plot this point using the length for age growth chart. First, we know Sam is 10 weeks old, so we find this line on the bottom of the chart. We also know he is 54.8 centimeters, and we find this on the left side of the chart. Using a straight edge, such as a ruler or the edge of a paper, we follow the mark at 54.8 centimeters across until it intersects with the 10-week line and make a visible mark where the lines meet. A few weeks later, when Sam is 3 months old, or 13 weeks, we measure him again. This time, he is 57.2 centimeters. We record this on the same growth chart using the same steps. Because we now have 2 points, we can connect them with a straight line. We then measure Sam every month. At 4 months, he is 59 centimeters. At 5 months, 61.7 centimeters. And at 6 months, 63.0 centimeters. Now that we have a series of points, we can look at Sam's growth pattern to assess his growth over time. What do these points tell you about Sam's growth pattern? Sam's length for age has closely tracked around the -2 z-score line for 4 months. This suggests that he's growing consistently and well, and he could be a small or short child by nature. However, because Sam is under the -2 z-score line, it is also possible he is stunted due to prolonged undernutrition or repeated illness, and is now catching up in growth. For this reason, it will be important to monitor Sam's growth and make sure he receives adequate nutrients to support his development. In situations like Sam's, it is important to consider all related factors, making sure to look at all of his growth charts, his overall health condition, and the height of his biological parents if known. Accurately plotting measurements on a growth chart is an important component of finding out if a child is following a normal growth pattern. If the growth pattern is not normal, it could indicate malnutrition. Remember, it's very important to consider a child's whole situation when interpreting trends on growth charts.